I had never even heard of esophageal cancer. And I knew I had to act fast because everything that I was reading online was about the morbidity that esophageal cancer was famous for. And so I started seeing different oncologists. Most of them were community based at first because, as a novice in the oncology world, I really didn't know where to start. So all of the local oncologists were, pretty brief in their prognosis. And they said, really just to wrap up my personal affairs, spend the last few months with my kids. And that was it. They didn't even recommend treatment of any kind other than palliative care to ease my discomfort. And I thought, this can't be right. The little bit I had read told me that I was far outside the normal group of people that get esophageal cancer. I wasn't a man. I wasn't over 65. I had never smoked. I did not indulge in much alcohol or poor eating habits. And I thought, this just can't be like it can't be my, ultimate outcome to die in a couple of months from a disease that I'm not supposed to have. So I quickly learned how important it is to get to an academic center. And I visited many of them up and down the East Coast. And much to my chagrin, a lot of the feedback I was getting from specialists in the country was still quite grim and didn't really offer much more than the community oncologist had. However, most of them did suggest that I get started on chemotherapy right away, get my port in, and not to delay any longer because I needed that systemic treatment. So once I finished a pretty tough course of EOX, which is not widely used in the esophageal cancer world, but it was what was available, and it worked with my insurance. I went through 8 cycles and I actually did pretty well. And with every scan in between, I was seeing more resolution. And it was a really, encouraging result. But still, I was having trouble getting the physicians, these renowned physicians, to talk about radiation therapy or surgery or anything else because, they said that's not part of the standard of care for a stage 4 patient. And again, I thought that I needed to have some different conversations because all of their stage 4 patients in general looked much different than me.